apologize for these extreme technical difficulties. It's been a very interesting day as we move through many things that are happening. And we wanted to come to the public to make some comments with respect to the passing of Honesty Hodges and provide an update and make some few remarks on behalf of the family, and then just talk to community about this COVID-19 and the seriousness of this pandemic. And it's taken our princess, Honesty, at a young age. And she should have been afforded many, many more chapters in her life. Honesty was a part of our NAACP Youth Council. And many of you know, we actually in 2011 represented Honesty when she was held at gunpoint at 11 years old by several GRPD officers who they were looking for a white female, 40 years of age, who had allegedly committed a crime. And GRPD showed up at Honesty's home as she was coming out of the back entrance to take a walk with her brothers to go to the store and get some candy and different things like that. And that incident totally terrorized her as well. And so we wanted to jump on and give our sincere condolences to Whitney, her mom, and her grandmother, Alicia, and also the entire Hodge family. And we are devastated. I actually found out about the news on late Saturday night on social media and did not want to believe it, thought it was some misinformation that was put out there. As I started to do a little more digging, found out that Honesty had tested positive for COVID-19 on her 14th birthday and was taken to Helen DeVos Children's Hospital Spectrum when she started to complain of abdominal pain. And so today we wanted to come on and really put a strong call out to really the Black community and encourage them and demand that they take all necessary precautions. That means wearing masks. That means wearing gloves when you're out in public if necessary. That means washing your hands for at least 20 seconds. That means also imposing a self-lockdown. We don't have to wait for an executive order in order to protect our community. And what that means for us as the NAACP, it means that take responsibility for your fellow brothers and sisters who are out here that may have high immune systems, that may be immunocompromised as well. And so what that means in addition to that is reduce your movement. We are in the midst of a pandemic. We are at numbers higher than in March when the entire country, entire world was shut down. And now right here in Kent County, the city of Grand Rapids, we're number 5 in terms of the number of COVID cases across the state and the number of deaths. And so, folks, we have to take this extremely, extremely serious. We have to take this extremely personal. This is personal to us, more now so than ever, because we lost one of our own, a 14-year-old young princess who had an incredible and remarkable life ahead of her. And now as we are preparing this week over the holiday season with her family to arrange for burial services for Honesty. And so this is what I will say as well. All of the folks who showed up at the city council meetings, who wrote us letters, not only from the city of Grand Rapids and across the state, but across the country, when honesty was held at gunpoint. We need to make sure that all of you be as vigilant against this pandemic. Again, I'll say that all of the folks who showed up and expressed interest when honesty was held at gunpoint, this is an opportunity for you to really honor her life fully. Honor her life by doing what is necessary, what is needed, and that is limit your movement. Limit your movement. We have to. I want to talk about also how this pandemic, how this virus is impacting youth and young adults. And this was interesting to me when we often hear about respiratory issues, right? Respiratory issues with respect to people having breathing problems or difficulty breathing. But what we saw in Honesty's case, it really started in the abdomen area, is my understanding. And so, again, we must be vigilant, and we must do everything within our power to make sure that we defeat this disease, this pandemic. We just haven't seen anything like this really in ever. And so there are almost 260,000 Americans that have died from this disease. Almost 260,000 Americans who have died from this horrific disease. So I think it is critically important for us to understand that those are real numbers. Those are real numbers. So a couple of things I'm going to ask for especially the Black community to do. I know many of us are excited about this holiday season. Many of us want to get together over the next few days for Thanksgiving, but I am going to ask you to not gather with family, only the people that live in your immediate household. Only the people that live in your immediate household. Please limit your activities in terms of the mall, in the grocery stores. When you are planning an activity to get food and necessary supplies, plan that in advance, plan that ahead. Know what you're getting, know what you're looking for, right? And again, that's being vigilant. Make sure you are carrying hand sanitizer and disinfectant in your vehicles, and extra masks and gloves if you have those. If you don't have any of those things, contact the NAACP at info@naacpgr.com, and we can make sure that we can get the necessary PPE out to individuals and families. I've asked Dr. Angela Andrews, who is an internal medicine and pediatric physician with Mercy Health Partners, to come on with us today and talk about, again, the impact of this pandemic on youth and young people, and some of the symptoms that show up when they present that we might not be fully aware of. And Dr. Andrews, I want you to talk about, from a healthcare perspective, the strain that this is putting on the entire healthcare system. Dr. Andrews, you can feel free to go ahead and jump in.
Yeah, as far as the strain that this is putting on the whole healthcare system, we're seeing quite a bit of community spread just in Grand Rapids alone. So that's impacting not only our community members, but it's also impacting healthcare workers. So healthcare workers are also getting sick, and they're out of commission. They have to also quarantine. So not only is it an issue of physical resources in the hospital, we actually need manpower. So if we can't contain the community spread, we're also going to be shorthanded on the people that are necessary to treat individuals who either have COVID or even not COVID, going in the hospital for heart failure or COPD exacerbation. You need to have hands on deck, but we can't do much if those people are also out sick. And as far as the symptoms that we need to be aware of, everyone is familiar with fever and cough. Those are still the most common symptoms that people will experience. The interesting thing is that children are more likely to only have mild symptoms. It might just look like a mild cold, or they just might have a fever. But as you mentioned, there is also the sore throat. You may have diarrhea, nausea, vomiting, stomach ache, fatigue, just being tired, having a new headache. Body aches, just not feeling well. So some symptoms that may seem like something mild may actually turn out to be COVID, especially in our young people. So that can't be overlooked. We oftentimes will say, oh, it could just be a regular cold, but right now the likelihood of COVID is much greater. We have at Mercy Health, we're seeing as high as a 22% positivity test rate. So that means of all the people who are getting tested for COVID, at least 22% of those people are testing positive. And that's not even from Metro Health and Spectrum. We know that Kent County is testing very high and actually higher than average in the rest of the state. I also pointed out one other thing that I wanted to make sure that everyone's aware of. We were talking about the importance of protecting ourselves. I think we all need to be aware that African Americans are 2 times more likely to die from COVID compared to the general population. So we know that COVID death rates aren't as high as they were earlier in the pandemic, but death rates are still higher for African Americans. And in some cities or in some states, the death rate is as many as 3 to 4 times as high. So, you have to keep that in mind. It's really important that we take charge of our health and do the best that we can. There are some factors, social determinants, that we don't have as much control over. So we have to do the best we can, protect ourselves, socially distance, wear masks, frequent hand washing, things of that nature.
Thank you. Thank you, Dr. Andrews. So I want to also bring into the room Tamiko Bolden, Professor Tamiko Bolden. She also is a therapist, a licensed therapist, and I'll allow her to introduce herself. And I want Tamiko to talk about the impact of trauma and stress, and how that can significantly impact our immune system and compromise our immune system. Again, as I stated earlier, many of you had a front row seat in the devastation that happened to Honesty when she was held at gunpoint by multiple officers and frisked, and handcuffed and put into the back of a patrol car. And that incident, that life-changing incident for her, significantly caused her really unbearable stress to the point that she went into therapy. Her actual entire family, her brothers who witnessed this, her mom and her grandmother all went into therapy. So Tamiko, if you could briefly introduce yourself and talk about the impact of stress and trauma.
Absolutely. My name is Tamiko Bolden. I serve on the board of Greater Grand Rapids Branch NAACP, and I am the policy chair. And I also am in private practice. And so, yes, definitely want to talk about how trauma, and specifically, I'm going to be highlighting multi-generational trauma, how it affects the immune system because it causes our stress levels to go up, which makes us more susceptible and have a higher proclivity to infections. So when we look at the word trauma, I want to kind of frame it looking at post-traumatic slave syndrome, PTSS. And PTSS is defined as a condition that exists when a population has experienced multi-generational trauma resulting from centuries of slavery, and that this population continues to experience oppression and racial inequalities and institutional racism. And when we look at that definition, of course, the Black and brown community are living and navigating through the space of multi-generational trauma. And any time of trauma, it causes the body to have higher levels of stress. And when our bodies are stressed, we begin to produce at a higher level the hormone cortisol. And when that hormone cortisol is released from the brain and gets into the body cavity, it reduces our body's ability to fight off antigens and causes us to become more susceptible to infections. So therefore, when we look at these variables, it becomes more clear. And it's not a mystery why the African American community are being impacted at a disproportionate rate with COVID when compared to, other ethnicities and our other counterparts, is because for years we have been living through the space of multi-generational trauma, which has causes us to have more stress and has impacted our immune systems. And so I think more so when we begin to talk about racism, and it's not a mystery that we have health disparities across the board when it comes to cancer, high blood pressure, diabetes. This is affected. This is a trauma narrative that doesn't get talked about. And racism and trauma has to be talked about integrated, they're perpendicular lines. The reason why there's racism is because it's created by fear, and that fear causes it to produces trauma that's cultivated in our communities, and we continue to live with it.
Wow, thank you for that. So you can see how years of stress and trauma plays a significant role, not only on your physical well-being, but also your mental well-being. And as we all know, Honesty was subject to an immense level of trauma and stress that she should have never had to deal with at 11 years young. So at this point, I want to field any questions from the media. If we have any questions from the media, and we can facilitate those questions. So we want them to put those in the chat or put them in the chat. Okay. Yeah, you can leave your questions in either the Zoom or the StreamYard, and then we'll respond to those. I think we have some coming in. Also, as we are looking at questions, we will again say that the family did not want to do a press conference at this time, and did not want to be on the platform because, again, they are going through the process of looking at burial services, also looking at funding to maybe establishing some type of a college fund in Honesty's name to support her two younger siblings, as well as I believe there is an autopsy that's being taken, that's underway as well. So I have a question, it looks like from Marissa at Fox 17, and this is for you, Dr. Andrews. Can you explain why the Black community is at a higher risk from dying and having serious complications due to COVID-19?
Well, that's not a simple or straightforward answer. We've already heard the importance of the impact of stress on the immune system and your body's ability to fight illnesses, and that impacts the increased risk of cardiovascular disease, heart attacks, and strokes that we also see in the Black community. Some other factors are going to be sometimes limited access to healthcare and also mistrust of the healthcare system, maybe a unwillingness to seek out the care or trust the advice, or maybe feel that your concerns are being taken seriously. I've heard countless times from patients having some reluctance or having issue or taking issue with healthcare providers or feeling that they weren't being heard, which is a major concern, and also drives a lot of mistrust. Not to mention some of the historical things that have happened that have also contributed to the mistrust of Blacks with the healthcare system. We also have to look at the fact that there just may be limited access to healthcare. Maybe there aren't as many communities. If you look at just where testing centers are, we have testing centers that are widespread in some more affluent areas, that are easy to get to. But think about the fact that in order to get tested, some of the lines can take as long as 4 hours if you don't have an appointment. And for a lot of our community members, getting time out of work and getting care, to daycare, taking 4 hours out of your schedule to go wait for a COVID test is really not going to happen. And if you can't get a COVID test, you can't verify you have an illness, maybe you're going to downplay what you're dealing with. There's just really quite too many options and too many factors, but we can look at poverty, we can look at access to healthcare, mistrust, and increased stress levels. That's the best way I would sum it up.
Okay, thank you. Do we have any other questions on the other platform from media or anyone else? One of the things as we're checking for other questions that I will say, and I will humbly ask the media specifically to do, is to give this family an opportunity to grieve. They have been bombarded, I should say, not only by local media, but national media and many media outlets across this country. So allow them to lay their baby to rest. And then at some point, I know they will be ready to make an official public comment. I will recognize Attorney Stephen Drew as well, who's here. He's a family attorney. He is on the stream. So I would ask you again, just to allow them to grieve and to lay their baby to rest through this process. The other thing I will say is on December the 5th, I believe that's confirmed that we are going to have COVID testing, and it's free testing. That location will be at Pilgrim Rest Baptist Church. It will be all outside, and Pilgrim Rest, the address is, I believe, 515 Franklin Street, but it's Pilgrim Rest Missionary Baptist Church. And so on December the 5th, so we will be posting information on NAACPGR.com, as well as our social media sites, Facebook, Twitter, and Instagram, with respect to that testing opportunity. In addition to the COVID testing, we are looking at providing free flu vaccinations as well. And so for individuals who may want to receive a flu vaccination, we're looking at administering those vaccinations as well on December the 5th. But we'll be sending out more information with respect to that opportunity. And again, I will say this as well. The NAACP, the entire NAACP family is in mourning and has been significantly impacted by the passing of Honesty. And so what we have decided to do is the NAACP of Greater Grand Rapids will take care of all burial and funeral expenses for the family, so they don't have to focus on that, and that will provide them some relief, hopefully. And we extended the opportunity and the ask because we wanted to make sure that they were okay with that. And so they said yes. And so we're going to take care of those services for the family. I will also say, in addition, there is a GoFundMe page that the family has set up. If you want to contribute to that GoFundMe page, I will strongly encourage you to do that as well. Again, those funds will be used for establishing a scholarship fund for Honesty's younger siblings, and also providing whatever direct needs and services that the family has moving forward. And just so they can have a little relief and respite during this time. So I would definitely encourage you to support the fund there. Are there any more questions from media?
I'd like to, do you mind if I add something?
Sure, Dr. Andrews.
There's an important point that one of my colleagues just brought up, Dr. Bragg, and at Spectrum Health. And one of those things that needs to be said, and I'm just going to take her words verbatim. You cannot test into being safe from COVID before you choose to gather. Neither can you test out of quarantine if you have had an exposure. So if you choose to gather, you are accepting the risk that you may contract COVID or spread it to loved ones unknowingly. So just if you've been exposed, take the recommendation seriously. Quarantine for 14 days. If you've tested positive, quarantine for 10 days after you first had symptoms and at least 24 hours after your last fever. It is imperative that we don't try to shortcut this because we want to be with our friends and family. I understand it's hard, but you don't want to have a holiday be their last holiday.
Yeah, that's right. Exactly. We have a follow-up question from Marissa, I believe at Fox 17. And the question is, what improvements could be made is what she's asking. And I think that was in reference, her initial question is, why is the Black community at a higher risk from dying from serious complications due to COVID? And so the follow-up question is, what improvements can be made? And I think either Dr. Andrews or Tomiko, if you want to both chime in on that, feel free to do so.
Tomiko, I spoke first and I piggybacked off some of the things you said. Would you like to go ahead and jump in first?
Sure, for sure. So I think some of the improvements that can be made is to really lean into, and we hear it a lot, the word self-care, but I would say self-love, and being able to nurture and find that balance from within to help people within our community to be able to move into a space of self-regulations that helps to give that immune system a boost from a natural space of loving oneself. And also looking at, we're talking about the holidays and, of course, people want to spend time with their loved ones, but knowing that, staying social distancing, that's how you're loving on your loved ones, by keeping yourself safe, keeping them safe. And so that we have to function as a collective to make sure we're looking out for one another and trusting that there'll be more holidays ahead. And so to love on self, to love on one another. I mean, that sounds really simple. When they say laughter is like medicine, that's true, but you can do that over a Facebook chat, a Zoom chat. I know it doesn't necessarily place that close proximity, but we have to consider the space we're in and govern ourselves appropriately. We have the hashtag in the NAACP, we're done dying. But with that, our behavior has to reflect we're done dying and really follow these medical protocols and guidelines that we've been given to keep our safe as well as our loved ones.
Thank you. And as far as just overall improving health and decreasing disparities, this is something that organizations have been wrestling with for many years. One thing that I agree with is doing better with self-care, exercising, making healthy food choices, doing the best you can to control the stress that you have control over, but you don't have control over a lot of stress. In addition to that, we need to, as a country, really strive to have more physicians of color because we know that patients of color are more likely to see their physicians and seek out care if they have a physician of color. Also more likely to just receive what seems to be more equitable treatment. In addition, having increased access to insurance. I know that that's a hot topic right now, but access to healthcare has also been a limiting factor for a lot of our community members. And then finally, not skimping on screenings. We talked a lot. We're talking a lot about COVID. If you have symptoms and getting screened and getting tested, if that's the case, but simple things like prostate cancer screening, colon cancer screening, getting your mammograms. Some of the issues we have is that people just aren't seeking out and taking care of themselves. They're not doing the preventive things that they can do to prevent some of these long-term consequences. So people are getting diagnosed with conditions much later when treating them is less plausible.
And I would like to just add one thing too, and also being able, people in our community having more of an openness to sit in therapeutic space, to really use the mental health and therapists in that platform of mental health professionals as a place to come, process, and actually move through the trauma and stressors that ultimately affects our health. So, and I know in our community, we tend to have more internal pause and more reservation about that, but having more of a space of openness to sit in therapeutic space to process through those emotional stressors.
I could not agree with you more. I hear this repeatedly among my patients. This is just not something we do. We don't see therapists. I'm not going to go do that. I can't understate the importance of seeking out care, getting therapy, even if that means starting a medication, but more importantly, making sure that you're finding someone that you can talk to that you trust.
Yeah, that's extremely important because we know, again, in the midst of this, in the beginning of this pandemic and period, many of us have been under severe mental health stress and strain. Just because we have been impacted, when you look at a lot of different areas, education, economically, health, all of these things, even in with respect to criminal justice and the horrific things that we've seen happen across this country in the middle of this pandemic, to like the George Floyds and the Breonna Taylors and all of those brothers and sisters who have lost their life at the hands of police bullying and brutality. And so I echo everything that Tamiko has said and that Dr. Andrews has said, is that it is critically important that we do self-care and we engage in that as well. So that's one of the things that we can do. I will say also, the actual address for Pilgrim Rest Missionary Baptist Church is 510 Franklin Street Southeast. And again, that's 510 Franklin Street Southeast. And we will be doing COVID testing on December the 5th. And we selected that specific week because we wanted to give people an opportunity who may think they've had exposure after the holidays, after this Thanksgiving holiday, to be able to come out and get tested. And so spread the word. We'll be putting more information out there with respect to that. Leonard had a question, where can we get tested? I know Baxter Community Center is doing a lot of testing and regular testing. I do understand that there is a wait now, but Baxter Community Center, which is located at 935 Baxter, so feel free to contact Baxter and they should be able to schedule you in for free COVID-19 testing. And so I think we don't have any other questions. And so again, I just want to strongly encourage the media to respect the family at this time as we prepare to eulogize and lay to rest Honesty, and just give them a little time to grieve, okay? And then at some point, I'm sure they will be open and willing to make a public statement. The family has indicated as well, if there are additional media requests following today, you can send those to the NAACP and we will share those requests when appropriate with Whitney and Honesty's grandmother, Alicia, and try to help them coordinate some of the media logistics around this. And so you can send all of those things, any inquiries that you have, to info@naacpgr.com. Again, that's info@naacpgr.com. And lastly, what I will say is please feel free to visit naacpgr.com. We have a pretty comprehensive COVID resource toolkit on the website. Because of the uptick, we are again beginning to look and make sure that all of the information that was poured into that resource toolkit is updated, that is relevant, and it's a good source for people to understand the available resources that exist in this community and then across the state of Michigan. And so we want to thank you all for coming. And I don't think there are any more questions. And so again,
one more. Yeah, I just wanted to kind of just reiterate one more thing before we go, because this pertains a lot to Honesty and the ACEs. A lot of people might have heard of adverse childhood experiences. This has a tremendous impact on your long-term health, whether it's your increased risk of death and dying, increased risk of depression, increased risk of heart disease and cancer. We know that stress is just as critical as avoiding things like tobacco exposure, obesity, and overweight. So if you want to know some of the things that affect the community of color, it's just this overwhelming amount of toxic stress, especially adverse childhood experiences. And honesty is an example of where that was the case.
Okay, thank you, Dr. Andrews. That's important. Well, Tamiko, thank you for joining us as well and pouring into this conversation. And again, we encourage you to stay safe, be vigilant, and please just keep it very minimum over this holiday season. Just celebrate with your immediate family that's in your home, your household, and bring other family members via all of the various technological platforms that are available to us when they work and when we understand how to navigate those things. But again, we're here as a resource to support community. This is something in terms of relief that we don't do because we're strictly a social justice organization, but we've had to pivot in order to help save our community. And so with that, again, I want to thank all of you for coming. If there are additional media questions, please feel free to send those as well to NAACPGR.com, and we will address those, any questions that's related to any of the information that we shared here today. So thank you guys and enjoy the rest of your day.